prospective randomized study. And what he found was that surgery, 98% of patients were very satisfied. Epidural steroid injection, only 46 to 52% of patients were very satisfied. So his conclusion was surgery is better. But what I like to see from that is 50% of patients got better with a steroid injection. Might as well try it, right? So 50% of patients are getting better. And I'll tell you, everybody I've injected so far has gotten better. So in spondy patients, like I said, the non-operative patients tended not to get much better. So if you're going to do a temporary injection that does not ultimately change the outcome, probably not very useful for that group. For the disc herniation group, temporary is all you need because there's a benign natural history. It tends to go away in 6 to 8 weeks, 6 months, a year and a half. Like 2 to 4 years, pretty much everyone's better. It has a lot to do with the temperament of the patient. Are they able to tolerate the pain for long enough? Or is there an economic reason they have to go to work to support their family that they need pain relief? There's a big, if they have severe progressive weakness, which we talked about already, huge indication of progressive weakness, because they're going to have that. The longer it stays there, the harder it is to get it to come back. Cauda equina syndrome, obviously, that's an emergency. You've got to get a surgical consultation right away if somebody has loss of bowel or bladder function, perineal numbness, whatever it is. They've got to come in right away. Failure of conservative management is iffy. What do you define as failure? That's kind of up to you, up to me, and up to the patient, really, what they define as failure. If they need to mobilize more quickly, which brings back in the socioeconomic factor. And if they have recurrent sciatica, I've got a better slide on that later. I'll refer back to recurrent sciatica. But after about 3 disc herniations, most people would just do the surgery and do the fusion, because they'll just keep getting worse and worse. So how about when we do the surgery, what are the results? Well, we already know from the sports trial and the Butterman trial, very, very high satisfaction rates, and they're much better off than if they don't have the surgery. Well, I shouldn't say much better, but they're better off. Hanley in 1989, 99% had initial relief, 7% rate of late symptomatic reherniation. We've got another study that I'll talk about later that really describes what the most important thing in reherniation